Hello everybody. Thanks for taking the time to watch our Medicare Open Enrollment webinar. We get a lot of questions in the pharmacy about open enrollment, so we thought we would bring a presentation to you that you could watch at your leisure to go over some basic concepts of Medicare Open Enrollment from a pharmacist perspective. This is our disclaimer. I'm in no way a certified insurance agent. This is strictly educational for our customers and our loyal Facebook fans, and it's just meant to be educational. So what is Medicare? Most people know Medicare is a health insurance program for people 65 and older, some patients younger than 65 with disabilities, or individuals with end-stage renal disease. This is part of the confusion of Medicare. So there's various parts of Medicare referred by letters. Part A, Part B, Part C, and Part D. At the pharmacy, most people use Part D for their prescription drugs. So Part D covers your prescription drugs. Part A and B are considered traditional Medicare. And Part A would be your hospital insurance. Part B is medical insurance. So when you go to the doctors, you get any blood work done, so Part A and Part B is your traditional Medicare. Part C is something called a Medicare Advantage plan. So if you don't have traditional Medicare, some people elect to enroll in a Medicare Advantage plan, which is all in one. So you have one card, and that one card is for the hospital, the doctor, the pharmacy, for blood work. So these are the different parts. So traditional Medicare is Part A and B. Your drug plan is Part D. This is what your original Medicare card would look like if somebody asks you if you have your Medicare card. Another thing we'll point out is most people should have gotten a new Medicare card in the mail. It was commonly included your Social Security number, so Medicare did away with that. And you can see on this example, the characters have replaced John Smith's Social Security number. So if you hadn't gotten your new card, you should call Medicare and ask for one for when you need to obtain services using your original Medicare card. The reason I talk about original Medicare versus an Advantage plan is there's two ways to receive your Medicare coverage. Option one, the traditional route, is you would have original Medicare, which is your Part A and Part B, and then you would get a drug plan, Part D. To confuse things a little bit more, you can buy a supplement that would cover what your out-of-pocket expense would be for your Part A and Part B. So Medicare covers 80% of the costs, and then the patient's responsible for 20% of the costs. If you purchase a supplement plan, the 20% would be picked up by the supplement. So just to go over option one again, you have traditional Medicare, A and B. You have a supplement that backs up A and B. And then you have a drug card, Part D, that you take to the pharmacy. That's traditional way to receive Medicare. Another way to receive your Medicare benefits is getting a Medicare Advantage plan. Think of that as an all-in-one plan. So we commonly get the question, which one's better? This is really based on your preference. Most of our customers like to receive original Medicare because they can go anywhere that they elect to go, and then their supplement would pick up the 20% that they're responsible for. Some other patients elect to get an Advantage plan because there's a strong presence of some local health systems in our area that they use for a doctor, they go to their hospital, so they're fine with picking a network like that to join. So just remember, if you get a Medicare Advantage plan, you have to just make sure your doctor accepts that Advantage plan that you're going to sign up for. So if you sign up for, let's just call it Medicare Advantage Plan A, make sure your physician takes that particular plan. Whereas if you have original Medicare, anybody that takes Medicare takes that card. So option 1 is a traditional route. Option 2 is Medicare Advantage. I generally will draw a picture to explain the different cards to people. So this is really a tough thing to verbalize to you, so I hope it's coming across correct. So option 1 and option 2, 2 ways to receive Medicare. Which option's best? We could talk about that in person to go over some of the common questions that you might have, but there's pros and cons to both options. So open enrollment. Every year, Medicare allows you to review your plans October 15th through December 7th, and then that coverage that you elect would come in, would start January 1st. So this is one time a year that Medicare wants you to shop and compare your drug plans or your Medicare Advantage plans. And there's many reasons to why you should, but Medicare understands that things change with you, and the insurance companies change their plans. So not only do you have changes, maybe your health has changed, maybe you're on new medications, but also the plans get to update what they cover, co-pays, so different things. Everybody just updates their plan once a year. So open enrollment begins October 15th and it ends December 7th. And then again, the coverage that you choose during that time goes into effect January 1st. So we're talking about open enrollment, but also just to give you a brief overview of different enrollment periods. Initial Medicare enrollment, general Medicare enrollment, and special enrollment periods. So initial Medicare enrollment is 3 months before you turn 65, 3 months after you turn 65. So this is the most common way people will sign up for Medicare. 3 months before or 3 months after you turn 65. We just had a couple people ask us this yesterday, so this is a good slide to look at. If you miss initial enrollment, you can sign up during Medicare general enrollment. So that would be January 1st to March 31st, and then the coverage would begin July 1st. And, you know, there's many reasons why you may qualify for a special enrollment period. We've put some common ones here that you could see: changes in household, loss of health insurance. Maybe you had health insurance from an employer and you recently retired. You had it maybe through a spouse and you're getting divorced. So there's different reasons, but just know there are special enrollment periods for certain circumstances that may happen in life. The reason why I always tell people about signing up for a Part D plan if you have original Medicare is most people don't realize that if you don't sign up for a Part D plan when you're eligible, then you will be penalized when you do decide to sign up. So here's a real life example. I have original Medicare. I turned 65, but I'm not on any medicines. So I'm just going to not sign up for a drug plan because I don't need one. So why would I sign up for one? And then a year later, they might have had an event that caused them to reconsider signing up for a drug plan. They will be penalized for the 12 months that they did not have a drug plan if they didn't have coverage elsewhere. So that is just a way that Medicare protects the insurance model, saying, look, you can't just sign up for insurance when you truly need it. You know, the plan is to keep a pool of risk. So A Part D penalty. If you don't sign up for a drug plan when you're eligible, you will be penalized in the future. So just remember that if you don't have other qualifying coverage. So just know that there's a penalty. Most people don't realize this until they end up signing up late. These are some common terms that we like to go over with our customers. And again, these are some, not only are these terms, but these are things that could change with plans every year. Monthly premium. So most plans have a monthly premium. Think of it as a membership cost. This cost is what you'll pay on a monthly basis. Some plans and most plans have deductibles. This is the amount of money that you have to pay out of pocket before the insurance kicks in. The deductibles for each Medicare plan change every year. Usually they bump up 10 to 15 bucks every year. This year I believe it's $445 deductible. Copay, most people are familiar with the term copay. This is the amount that you're expected to pay after you've met your deductible. So if your copay is $10 at the pharmacy, $20 at the pharmacy, that is your responsibility to pay for the service. Tiers and formularies. So each drug plan has a formulary of drugs. Think of it as a menu of drugs that they'll cover. And they break that menu down into tiers. So A, your drug has to be on the menu. And then B, what tier does it fall under? Most tiers of drugs are categorized into what are now 4 categories. 2 falling under generic drugs and 2 falling under brand name drugs. So there used to just be a generic copay and a brand copay. And then most companies came out with preferred generic, non-preferred generic, preferred brand, non-preferred brand. So depending on what tier your medication falls in, usually dictates your copay. So again, there's different tiers for each plan. Each plan has its own formulary, and they are able to change that plan or formulary every year, which is why we strongly encourage everyone to compare their drug plan, because your drugs may or may not stay covered even if they are covered today, or the copay may change. Even if you're used to paying a certain copay this year, that doesn't mean your copay is going to stay the same next year with that plan. Most people are aware of this term prior authorization, but if you're not, your doctor may order a prescription and you go to the pharmacy to pick it up, and you hear that it's not covered unless your doctor sends paperwork to the insurance. So a prior authorization is a step where the doctor needs to submit additional paperwork to your insurance company for your insurance company to review if they are planning on paying for it or not. So the pharmacies have no control over this, even though we bear the brunt of it. But this is strictly between your doctor and your insurance company. So prior authorizations of certain drugs also change every year. So these are some common terms. This is probably the most confusing subject when it comes to Medicare Part D. So Medicare Part D, if you look at this, it goes left to right. Annual deductible. So day 1, January 1st, when the calendar flips over and your plan starts, if you have a deductible, basically you need to pay your way through these different coverage areas. So you would be responsible for the out-of-pocket expenses for your drugs during the deductible phase. And then as you pay out of it, you go into the initial coverage area which is where you'll have the standard copays that you're expecting to pay. And then if you're on expensive medications, when you and your insurance company spend X amount of dollars, this year it would be $4,130, then you fall into the coverage gap, also known as the donut hole. During this part of the coverage, the patient is responsible for more out of pocket than you were in the previous phase of coverage. The good news, which is not great news, but the good news is when you're in the donut hole this year, and if you're on a brand name drug, you will be responsible for 25% of the cost of the drug. Previously, it was as high as 50%. So this donut hole has been closing a little bit over time. But during this phase in coverage, you are certainly responsible for more of the out-of-pocket expense. And then, again, once you spend your way through that coverage, you land in the catastrophic coverage. And this is when your insurance company takes over a major part of the expense, and then you have small expenses during this time. So day one, coverage starts. You pay your deductible in the beginning of the year. Once you pay your deductible, you go into your initial coverage period. And during this period of time is when you would have your standard copays. However, once you and your insurance company spend a certain amount of money, you fall into a different phase called the coverage gap, where you're responsible for more out of pocket. And then you fall into the catastrophic coverage once you spend your way out of the coverage gap or the donut hole. And then in this phase, your insurance company bears the brunt of the cost. So phases of coverage, normally people don't care about this until they fall into the coverage gap because they're alarmed when their copay is significantly higher at the pharmacy. Also, in the beginning of the year, most people often forget they have a deductible in the beginning of the year, even though it happens every year. It's just something that we're not, remembering until it starts. And then, as you see at the end, every year, this monetary number restarts. So how to choose the best plan? What most people don't understand is the best plan for you is drug specific to your medications. So we take at the pharmacy a list of the medications you take today, and we screen those drugs against all of the plans that are available. Probably over 30 plans available in our area. So once we take your list of drugs, we screen them against all of the plans. And then it will come back with a couple different numbers. And I'll show you it on the next slide. But we compare deductibles, we compare copays, but the biggest number we look for is your out-of-pocket expense for the entire year. Because remember, it is for the entire year that you're going to be in this plan. So the best way to judge is based on your expenses for the entire year. Some people rush to judgment and they sign up for the cheapest plan based on monthly premium. So they might see a monthly premium that's $15 a month, so they sign up for that thinking that that's the cheapest, but then what they don't realize is their copays are significantly higher throughout the year, causing their out-of-pocket expenses to surge. So it's very drug specific to your drugs. Another thing, if you're willing to change medications, as I mentioned, a lot of formularies change every year. And, there might be generics available, or certain plans may have different brand name drugs that they prefer. So if you imagine like a Lantus So Lantus is an insulin, Basaglar is an insulin comparable to that. One plan might prefer one over the other. So there's opportunities if you're on a brand name drug to look at if you're open to switching them, if there is a better plan that would save you money if you switched. So best plan is based on your drugs as they are today. Unfortunately, we can't predict the future. If you get a new medication added in the middle of the year, it's kind of going to change your expenses as you would expect. But a drug-specific plan comparison is what we encourage all of our customers to do once a year. So this is what we will punch your drugs into this plan. So we have a pharmacy software system here at the pharmacy that we pay for to help assist our customers in comparing drug plans. And as you can see, this is a comparison for a real patient, and it's there's three different drug plans that we're comparing. So along the top, you could see the three different plans: Indie Health Elite RX, Indie Health Saver RX, Silver Script Choice. So some plans, some companies have multiple plans. So you want to make sure you're signing up for the best plan based on the plan ID, which you could see under that, or the name. But so Indie Health Elite, Indie Health Saver, and then there's a plan ID. That's that S3535005. And again, this is a specific example for a patient. So in no way are we encouraging you to sign up for either of these plans. We're just showing you what the comparison looks like. So then we jump down to drug coverage. Monthly premium, as you can see, it compares the three premiums for these plans. So one may think by signing up for the cheapest premium all the way at the end, they're going to save money. But that's not true, as you can see in this example. So then the next line is the premium. So that's the amount that you pay every month. And then it will break down if the plan has a deductible or no deductible. Lastly, and this is the most important line that I always look at for our customers, is estimated out-of-pocket expenses for the entire year. So you could see if this patient picks that first plan, he would be estimated to spend $34.67 for the entire year. Now what that includes is his monthly premium, so $47.10 times 12 months, and then it includes all of his co-pays for all of his drugs for the entire year. So estimated out-of-pocket expense for having drug coverage and for buying his drugs would be $34.67. And then we always include at least three to compare, because someone might not be comfortable with a deductible. So an example would be these two first plans. He could pay a little bit more and not have a deductible. And then as you can see, it saves him for the entire year. So this would be the front sheet. You would get a comparison of the three most effective plans. And then ultimately it's up to you to make a decision. We cannot make a decision for you. We can only help guide, give you information to make the best decision. You would have to enroll. You can enroll by phone. Most people elect to enroll by phone. Common question we get is, do I have to call the old insurance company and cancel it, or do I just call the new insurance? So when you call your new insurance company, they would just make that effective for the new year, and you wouldn't have to call your current plan. And I'm sure everyone is getting bombarded with letters and phone calls and TV commercials, so it's really confusing time for Medicare Open Enrollment, because you get so much junk mail, so much mail that might actually be something you should be looking at, but you're not looking at it. So keep in mind, we are here to help in any way we could, and this comparison is a huge benefit to our customers. So then you could see back here, I told you his estimated out-of-pocket is $34.67. The next page of our comparison would break it down and show you what you would expect to pay on a monthly basis for, again, your drug premium and your co-pays at the pharmacy. So this is helpful because, you know, it would show when you're projected to hit the donut hole, so you could save some extra money during those times. And then that's just a breakdown of monthly expenses. So this is just a broad overview, and this breaks it down by month. Patients are often overwhelmed by the process, so they don't know where to start, so they don't compare plans. And why we say that is because there's a study done in 2017 that showed 90% of Medicare beneficiaries are not on the most cost-effective plans for their medications. I'll give you an example. We had a patient, she's paying for a Mercedes drug plan. It's $87 a month. There's no deductible. And she signed up for it because she went to a dinner that was hosted by this plan. And she's only on 3 or 4 generic medications. So she's paying $87 a month for coverage. She's extremely over covered. And, you know, maybe some people make that decision on purpose, but I share that example because she just didn't know that she didn't need that rich of a plan. And she's not alone because, as the statistics shows, 90% of patients aren't on the best plan for their medications. So we talked a little bit about the pitfalls, and this is what we hear in the pharmacy. My neighbor said XYZ plan is the best, so I chose it. Your neighbor is on completely different medications than you're on, so that doesn't matter. If they like a plan, that's great for them to like the plan, but it's no reason for you to sign up for it. We see a lot of husbands and we see a lot of couples, husband and wives, that they just want to pick the same plan to be on the same plan. But again, your medications may be different than your spouse's. So signing up for the same plan just to sign up for the same plan doesn't make sense. So that's another common pitfall. The TV is filled with free, get this, get that. They overpromise and underdeliver a majority of the time. So be cautious when you're watching TV. Obviously, they're spending a lot of money to get you to sign up for something that's free. My plan is fine. I'm going to keep it next year. That's fine too, but just remember that the plan might change. So you're going to keep the same plan, but it may change. So just know that if you do want to keep the same plan and you're happy with it, that's fine, but it might change. Lastly, and the most important thing I could say, during this time of the year, large pharmacies and large insurance companies try their hardest to mislead customers to switch pharmacies. Why do they do that? Because they own the insurance company and they own the pharmacy. So it's their way to minimize their costs and increase the amount of money they make by keeping you all under one roof, so to speak. But when it comes to Medicare, you always have the option of where you want to receive your benefits. So do not be misled by your insurance company. If you get a letter and it's confusing or it says you have to use a different pharmacy, we would encourage you to call us because most of the time it is completely inaccurate. So these are some common pitfalls. There's certainly more, as you can imagine, but your biggest one is to just not take a look at your plan. So I would encourage everyone to at least take a look at their plan. And some other programs that we like to promote to our customers, because not many people know about them, is a state program and then obviously a federal program. So the Pennsylvania PACE program offers medication assistance for Pennsylvania residents who are 65 years and older that meet income requirements. These income requirements were adjusted last year. Again, a majority of people may qualify for these, but they just don't apply. So we try to encourage people to explore all avenues for assistance with medication costs, because they are indeed ridiculous. So PACE is a state program. Again, Pennsylvania resident, 65 years and older. Income limits are listed there. Another one, which is through the federal government, is Extra Help, and that's through Social Security. Different income requirements. They look at resources. They don't just look at income. But just know that these programs are out there, and it doesn't hurt to at least try to see if you qualify. Our pharmacists are really in tune to all of this information, because we know it makes a difference in your lives. We know medications are expensive. We know insurance is confusing. We're not here to just fill prescriptions. We're here to offer our professional advice to you on so many different categories or areas, one of which is just your total health care and your health insurance. So we appreciate you watching this, and if you have any questions, please feel free to give us a call, and we'd be sure to answer your questions to the best that we can. Thank you.